Welcome back to Cancers 101. I'm Rittika, and today we are diving into a rising and urgent concern in cancer care, the surge of multi drug resistance infection in immunocompromised patients. When cancer weakens the immune system and hospital becomes second home, patients are exposed to new enemies, superbugs that don't respond to standard treatment. These are the infections that slip past our best defenses. And as always, I'm joined by my co host and infection disease expert, Aditi. Aditi, this is a war we didn't see coming, right?
Absolutely. We are seeing a rise in pathogens that shrug off multiple antibiotics like MRSA, methicillin-resistant Staphylococcus aureus, carbapenem-resistant Enterobacteriaceae, that is CRE, and the infamous Candida auris, a multi-drug resistant fungus that's alarmingly persistent. These microbes are not only resistant, they are relentless. They thrive in hospital settings, particularly where patients have weakened immune defenses and multiple invasive lines, like ports, catheters, and ventilators.
It's like we have been building walls against infection for decades, only to find that some enemies have evolved into climbers, tunnelers, and shapeshifters. So, what makes cancer patients such easy targets for these superbugs?
There are a few key reasons. Prolonged hospital stays, especially in ICUs or transplant units. Frequent use of broad-spectrum antibiotics, which can disrupt the microbiome and select for resistance. Neutropenia, where white blood cells are dangerously low. And use of invasive medical devices like central lines, feeding tubes, and ventilators. Plus, cancer patients often cycle through multiple therapies, chemo, radiation, even surgeries, creating repeated windows of vulnerability.
They're like castles constantly under siege, with the drawbridges drawn down more often than up. And when the invading forces are resistant, our usual weapons just don't work. Let's bring in a real life example. A middle aged woman undergoing chemotherapy for triple negative breast cancer developed a central line associated bloodstream infection. The cause? Carbapenem resistant Klebsiella pneumonia. Despite multiple antibiotics, the infection persisted and she needed colistin, a long resort drug with toxic side effects. The infection delayed her chemo for over a month and her overall prognosis was worsened.
It's a devastating pattern. The infection becomes as threatening as the cancer itself, and we are running out of effective drugs to keep up.
So, how do clinicians respond to this rise in drug resistance?
It's all about prevention and innovation. Strict infection control protocols, hand hygiene, isolating infected patients, and thorough disinfection. Antimicrobial stewardship, using antibiotics only when necessary and choosing the right one. Rapid diagnostics, PCR, and sequencing help identify resistant early. New antimicrobial therapies like ceftazidime, avibactam, cefiderocol, and combination therapies, and even bacteriophage therapy, viruses that specifically kill bacteria, are being trailed.
It's like modern medicine is entering a new arms race, but this time we need to be smarter, not just stronger. Because when resistance wins, even minor infections become life threatening. So let's recap what we learned today. Multi drug resistant pathogens are rising threats in cancer care, particularly in hospitals. Immunocompromised patients are vulnerable, especially with invasive lines, broad spectrum antibiotic use. Prevention, early detection, responsible antimicrobial use are our best bets. And the future lies in new therapies, better diagnostics, a global strategy to outspace resistance.
Superbugs don't just threaten individual patients, they threaten the entire healthcare system. But with vigilance, science, and collaboration, we can turn the tide.
Thanks for joining in this episode of Cancers 101. If you found today's episode eye opening, make sure to share it and help us spread the awareness about the invisible battles happening in hospitals every day.
We'll see you next time. Stay safe, stay informed.